Hey, hey, we are back for another in the series of Coochie Care 101. So, we're going to talk about healthy. What is a healthy coochie? Kitty care. What are some things that you could be doing? What are some things that you may have heard about or maybe even attempted that may or may not be as beneficial for you? So we're going to break down some of those coochie care tips. My name is Dr. Letitia Williams, licensed physical therapist, pelvic floor specialist, and menopause coaching specialist. My whole vision is to make sure you have the knowledge to take care of your bodies and you become the CEO of your health, especially if you're a woman over the age of 35. You are at the right place. If you haven't already followed me, you can follow me at Renew Her Physio, as well as Thrive Longevity Fitness, where we combine things for fitness, wellness, pelvic health, menopause, and beyond, as well as prenatal and postpartum as well. But we're breaking on down for some coochie care tips. If you have questions, you're viewing this live in the future, later on, please drop those questions down in there. If you want to be able to get and grab my free guide on 5 coochie care tips, go ahead and put a kitty emoji down in the comments and we'll get that to you. So basics. What kitty care actually means. So first of all, it's not about being overly clean. Your vagina is self-cleaning. A healthy vaginal ecosystem, that's everything they make, that equals balanced hormones, good bacteria. So there are some good things that help keep the environment, our vaginal environment, healthy. And having some good habits when you're talking about that. So, common mistakes. There's probably going to be several of these, but douching, scented wipes, aggressive scrubbing. Okay, we do like clean, but you ain't gotta beat her up like that. So we're gonna talk just briefly about those but we also want to normalize discharge. There are what's normal and versus what to check on. There are some discharge that's needed, that you're naturally is going to occur. So, coochie care tip 1 is use water, not perfume. So, your external vulva care, I'm going to grab my model back out again. So, if you're just hopping in, you've never been on these before, this is my pelvic model. This is the lower part of your spine. These are the hips here, everything in red as part of your pelvic floor muscles. So this view here is if you were looking down below, you had a mirror or something, you'd be able to see the things on the outside. So the vulva, so to see, that's everything on the outside is the vulva. Internally, vagina. So when I'm saying vulva, I mean everything on the outside. So our vulva care does not need scrubbed, perfumed, douched, yoni steamed, none of that. So what can happen with douche? If you do, it can actually change several of these things. Using harsh soaps, scrubbing, using things with fragrance, perfume, douching, noni steams. Introducing some of those things can actually change the necessary balance of vaginal flora. That means bacteria that live in the vagina. We have to have a healthy amount of bacteria that helps keep our the vaginal environment acidic as well, so that it will do everything it needs to. It's going to be the balance. So we need the balance of bacteria that helps maintain the acidic environment. That's the environment that's required for healthy vajayjay. Boom. So when you're introducing things into that environment, it can start disrupting the healthy, the normal type of bacteria that's supposed to be there. So that could even be during go sexy time, watching some of those oils. You're going over to Cirilla's. If you're on there, you know what Cirilla's are, or wherever you're shopping, and you're getting some of these lotions and potions, and they have a lot of fragrance, synthetic dyes, and things in there, and you're gonna introduce that to Kitty or the Secret Garden. Be aware that you're introducing something that could be a disruption to that normal healthy bacteria. So your little oils, little chocolate syrup, whatever you using or you trying to do, be aware healthy vaginal bacteria can be affected introducing things. Now, there's things that are introduced that are natural to the environment, like we're talking about semen. Yes, does that disrupt the environment? Yes, it does. But definitely those things that we're talking about that are external things, putting them lotions, potion, dyes, and all that thing, introduce them, not needed. Your girl knows how to self-clean herself, so we don't need any steam cleaning going on. There may be some people that may not like that, but that's okay. We're all good. So what can we do? Next up, building her strength. So healthy vaginal, healthy pelvic floor, healthy vagina, vulva, which is outside externally, includes muscles, moisture, and movement. Muscles, moisture, movement. Muscles, moisture, movement. If there's not anything that you remember, remember that. So you want to, when we're talking about healthy pelvic floor, put my model back on there. So the pelvic floor, what it does, bladder, bowel, sexual function, and support. Bowel, bladder, sexual function, support. All of these things here in red that you're seeing, our pelvic floor muscles, they all need to work together. And with strength, coordination, and being able to relax as well. So we sometimes get tied into the whole tighten. Gotta keep it tight, right? Sometimes it's overly, the muscles are overly tight. And that's not going to be a good thing, because in order for us to be able to experience pleasure and get to that next level, the muscles have to be able to relax. You can't just say, no one all day is walking around with their shoulders up here and tight and just clenching everything all day long. If you're doing that, guess what? Something's going to get tired. Something's going to get fatigued. And it will not be a comfortable scene for you. Same thing with your pelvic floor muscles. If you're tight all the time, you might notice, you might actually have a few pelvic floor issues. They may pop up. But anyways, so doing a pelvic floor contraction correctly, and if it's appropriate for you. So it's not just Kegels, everybody. You get a Kegel, I get a Kegel. You Oprah out here dropping Kegels to everybody. That's not how it works. It has to be individualized to the person. So some warning signs of dysfunction, or if those muscles are coordinated, the kitty's not happy, we have to pay attention to these. So you're going to be having leaking. That's if you sneeze, cough, jump, a load or anything like that. Leaking urine. Or even if you have the urgency, or on the other end, you always have to stop by the bathroom and just go just in case. As soon as you walk to hit the door, boom, it hits you. All of a sudden, you got to run to go to the bathroom, and you're thinking, if I don't get here, I may not make it. Some people just brush that off as, oh, as I'm getting older, and that's what's supposed to happen. I'm supposed to, go to the bathroom all the time. I'll just wear a pad or a brief in my Depends and keep it to moving. No. Let's say if you've been on this live before and you see me type of word, that ain't it. That's not the quality of life that we're looking for. So if you want that, you can go ahead and hop on off. If you are looking forward to wearing adult diapers, if you're looking forward to decreasing your quality of life because aches, pains, fear of not being able to make it to the bathroom, heaviness, a feeling of fullness or heaviness, or feeling like your vagina is going to fall out, or pain with intercourse. Those are all things that could be seeming to flash that maybe there's some pelvic floor or, something is not working appropriately, and it's not just normal because of this, that, and the other. So our goal is to be able to strengthen her from the inside out. That's why having the right way to be able to do Kegels, if that's appropriate, for you at that time. Also, to be able to strengthen from the inside out, it also is going to include core, hip work, breath work, and then seeing a pelvic physical therapist like myself as well, if we're noticing that you're having more issues or something that's affecting quality of life, or something you thought that was just normal and you had to live with, and now there's solutions and help for you out there. So let's pop in here. Moisture matters. So vaginal dryness can significantly affect quality of life behind intimacy. So it's not just about intimacy, especially for women over 40 when we're going through different hormonal changes. The vagina is the key part of your pelvic health system. So not just sexual function, but there's reasons, or let's take a little bit about how vaginal dryness can affect more than just intimacy. There's some individuals that are not worried about that. Like, I forgot about that a long time ago. That's not me, not worried about that. But guess what? More things are attached to that vaginal dryness. So, everyday discomfort. So, dryness equals irritation. The vaginal tissue, as we are progressing 40 plus, perimenopause, menopause, postmenopause, the vaginal tissue becomes thinner and less elastic due to lower estrogen. So that makes it more prone to burning, itching, chafing during movement or while wearing tight clothes. Yes, irritation can occur. So if you don't have enough moisture, these are some of the things that can cause discomfort, decrease quality of life. So you can also have discomfort when, sitting, walking, exercising. If you think about, you have dryness and now you have friction or constant friction within your clothes or your legs or thighs, and it's just not going to make it comfortable for you to be able to move. So sitting, walking, exercising, you can have discomfort with those. There's also, with vaginal dryness, increased risk of infections. So, like I said before, healthy vaginal moisture supports, balanced pH. And those beneficial bacteria, like lactobacilli. So dryness, it can disrupt that balance. So sometimes you can get more incidents of UTIs or urinary tract infections, vaginal odor or discharge due to imbalances, and odor that's going to be odor that's different to you. An abnormal odor that is not part of your normal discharge. And that's why it's important to know what your normal is so that you can help identify what might be abnormal. And paying a close attention about, I got to find out and know my anatomy and know what's going on with my body. Because like I said, you're the CEO of your health. If you're not leading and directing and all that, how are you going to get somebody else to be able to help in that area? So, other thing with vaginal dryness, bladder symptoms. So, the urethra, well, we already said, let me go back here. And that's part of probably really, so the urethra, that's the good old P right there. Your vaginal tissue, they share, your urethra and the vaginal, they share estrogen receptors. So when estrogen stops, or definitely stops producing and significantly drops during menopause and beyond, both can become thinner and more fragile. So this can cause the urgency, have to go to the bathroom, leakage, burning with urination. Some women feel like they have a UTI, but they don't. It's often vaginal dryness that's affecting the surrounding tissues. And those tissues get dry, get irritated, and it's not a fun scene. So we also know that there's an emotional and mental health impact. So persistent irritation or bladder issues, it can affect sleep, daily movement, your confidence. Many women feel embarrassed or isolated, and they don't even bring it up to their doctor because they don't know how they're going to respond, or like if there's anything that can even be done, they just shy away at it. So we're all about quality of life. You have good quality life, you're going to feel better in your body, better in your everyday life. So when the coochie feels dry, kitty feels dry, uncomfortable, irritated, you need to be able to get help and address it. Okay. And it's going to, when you're having that, it's going to affect the way you move, your dress, how you feel or present yourself in your body as well. The good news is there's vaginal moisturizers. Dee-dee. Yes. There's also vaginal estrogen, which is not the same as HRT or hormone therapy. And then there's pelvic health strategies that can help restore comfort, moisture, and confidence. Whether or not sex is on the radar or not for you. So dryness isn't just about sex. It affects quality of life. Now, we definitely don't want to be dry with intercourse. We need all of it. But there's some individuals that think, oh, if that doesn't pertain to me, then that's not something I have to worry about. Be informed. So what can we do with dryness? Like you said, there's vaginal moisturizers, hydrating your body, in general, and staying away from all of the disruptors that can occur that can affect that healthy bacteria that we need as well. That can also help with vaginal dryness. So moving on to, let's think about lifestyle plus pleasure equals long-term health. Lifestyle plus pleasure equals long-term health. So what can we do? Nutrition and movement. So we're talking about diets high in fiber, fermented foods, gut, because your gut and your vaginal health is connected. So when we talk about gut and healthy things in the gut, we think about that lactobacilli. That's that bacteria that is a key component of keeping the pH levels and our vaginal pH levels at the level that they need to be. It needs to be in an acidic environment to thrive. So there's going to be good bacteria, bad bacteria, or good bacteria that we need. So we shouldn't just be like, oh, I need to get rid of all of it. That's going to be detrimental. So I'm trying to think about the studies over here. I saw when I was looking at a study, and they talked about the healthy microbiota is in the vaginal tract. And we say that a healthy vaginal tract is low bacterial diversity and high abundance of vaginal lactobacilli. These lactobacilli play a fundamental role in interacting with the most innate immune system, and research shows that the low abundance of lactobacilli increases the risk of several vaginal infections. So, guess what? You're like, how do I know if I have low bacteria? As far as I can see, there's no test or there's no, sign. It could be no symptoms at all. But what can you do? You can easily make some lifestyle things to help support that. So think about yogurt, kombucha, tempeh, especially if you're vegan or vegan, tempeh, or not vegan at all. You don't have to. Sauerkraut, kefir, olives, sourdough bread. That's just several different things here that incorporating those into your body, they have higher amounts of that lactobacilli. So what can we do to help support ourselves? Like I said, take care of your gut health as well. So we have our movement, we have our gut health, we have our sexual health. So we know that sexual health, pleasure helps circulation. Let me say that again. Pleasure helps circulation. So and hormone and regular movement improves circulation and hormonal balance. So exercise. Some think, I don't really like to exercise. I just go on a walk. Well, just think about that. Regular movement improves circulation, and we know that pleasure helps circulation. So let's put that together. Exercise, better pleasure. But it does talk to. Even if you're talking about the partner or yourself. So we can normalize solo play as self-care. I as well. You also want to communicate with your partner, especially in perimenopause, menopause, and beyond, when you may have some changes in libido, or you're noticing that lubrication, or you're more dry. You don't want to just be in the status of grin and bear it, and it's for the good of my partner. Is that we have to be able to communicate where we are, what we're feeling, and here's some solutions, so that your partner just not sitting there in the dark like, oh, they don't want to do anything, or what's wrong with me, or what's wrong with them. So I think it's a really really important key to make sure that your partner is involved and that you are communicating. So the little coochie tip: use her or lose her. No, I'm just playing. But think about some ways you can help support lubrication, movement, the healthy bacteria. Those are all things you can do that will take minimal effort to be able to help. And it's not doing, some large supplement complex or doing drastic changes. It's really looking at some things that can be very basic. So we're going to get close to wrapping up. Let's talk about the checklist, your coochie checklist. You're not taking notes, boom. Make sure you come back to this part in the video or take notes. So we have some weekly or monthly, some of these could be monthly habits, so that you can keep that healthy kitty life going. Just think about this, and this is gonna be, daily. We don't have to put what it is, but this is just a list. Wash gently externally. Okay. So we're not we is getting all that and just being rough and tumble. And you may not be, if you're really sensitive, that may not even be comfortable for you to do it all. So wash gently outside. We're not shoving things in the inside in the vagina to clean. Wear breathable underwear. So cotton, you can wear cotton, or you want to go commando and you feeling good, on your own time, that's your own business. You can try that as well. Stay hydrated. Move your body daily. Very important. And that's overall in life. Get regular pelvic floor checkups. If you're, even if you want to, it's time to get a check-in. If you're normally like, oh, I go to the gynecologist this many times, whatever. But also just going to check in to see what your pelvic health looks like. Like, hey, I have a history of this in the past. I may have had a child. I may have issue with, frequency. I'm going to the bathroom, or it's very urgent, or I'm having pelvic pain. I have hip and low back pain, history of a surgery. All these different things can play a role in kind of what your pelvic health looks like. So doing those check-ins, especially if you're noticing some changes into that during that menopause transition and beyond. Because once again, once you've been on menopause, you're post-menopause. You're always post-menopause. So I know people say, oh, I already went through that, the hot flashes and such and such. You're always going to be post-menopausal. that's where it at. So what can we do to make adjustments and changes and not just so focused on, oh, hot flashes, night sweats. Oh, I've kind of gone through that segment and that's pretty much it. There's also going to be varying levels of individuals. They may not have a lot of the symptoms. They may have some of the things that are more that you don't see, or you don't necessarily equate to menopause as well. So, oh yeah, and then basically is listen to her cues. The kitty will tell you if there's something wrong or if there's something abnormal. So think itching, odor, dryness. We need to investigate and not ignore. Investigate and not ignore. So really when it comes down to it, recap. Your coochie is powerful, intelligent, and deserving of every single season that you're in. So it's not more important during this time, less important during this time, every season that you're in. So let's go ahead and find out and discover, investigate if you have to, find out what's normal, what's for you, test, find out, and let's continue to be the CEO of our health, including that kitty as well. if you're going to be popping this and you want to get my, I think I had a quick little, yes, Coochie Care cheat sheet. If you want that Coochie Care cheat sheet, go ahead and drop a kitty down in those comments and we'll get that right over to you. Make sure you continue to tune in to the rest of my Coochie 101 series. You can scroll down on my page and you can find, I think I have one of them pinned as well. If you don't already follow me, share this or tag a sister friend that needs to know this information and drop that kitty down in the comments for your Coochie Care cheat sheet.